Okay na ba kayong lahat? Meron na kayo? Kompleto na ba yung attendance? 99 pa naman kayo.
But na-remind ko na po yung
Hello?
class. I'm not sure where are the others po if they're not here.
Yes? Chappy. Ano na na?
But we should be around 100 plus po dapat.
Can you repeat what you have said? What? Can you repeat it? Yeah.
But we should be around.
Oo, 100 plus kayo,
Yes,
diba?
po.
Kaya lang 99 lang naman kayo.
I-chat
So,
ko na lang ulit po sa group chat.
i-grade ko sa kanila for the... Meron. Okay. Hello? Can you hear me?
Yes po.
Pero hindi ko kayo marinig clearly. Hello? Ilan na kayo ngayon? So, you're 99 pa rin kayo. So, kulang. So, I'm going to grade them 0. Okay, let's start. Can we start now? Kahit 99 lang kayo. So, yung wala for this SGD, 0 sila. Okay? Understood? It's already 7:28. I will give them 2 minutes. And per group, you should write the names of your classmates na nag-participate dito sa SGD. If wala sila, you have to be honest. Kasi lugi naman kayo, di ba? Mag-effort kayo na mag-SGD and then wala sila. Tapos may grade sila, kayo wala. Ay, kayo meron, pero nandiyan pa rin kayo. Okay? Huwag i-tolerate ang hindi magandang ugali. So, if absent, absent. So, may dumagdag na 3. So, 100. So, ang gagawin natin is, you will be going to choose number. Mayroon tayong number dito, papakita ko sa screen, and then you just tell me what number you like, and then titingnan ko dun sa cases assigned, tapos yun yung aansaran ninyo for your SGD per group. This is a group effort and a group grade. Okay, so 50% from the 50% of your grade would be from the written answers, and then the 50% would be from your SGD mismo. Okay, you have to answer all the questions that were asked, and then you have to discuss with the group, and also don't leave. Kung sino yung magli-leave, kahit hindi naman sila yung group na nagdi-discuss, they will be marked as 0. Okay? Kasi while you are listening to other groups, you may learn and mas makakapulot pa kayo other ideas from ACLS and exam ninyo ito. Okay? And also, so bonus na sa inyo yung mayroon kayong coding. You have to do it good. Kasi all you have to do is to answer the questions I am going to ask you. Aside from the questions na nandiyan na sa binigay kong cases. Okay? Okay, can we start now? So, are you assigned groups 1 to 10? Dr.
Yes, po, Doc.
Elijah?
Yes po, Doc. 1 to 10 or 8 to the last level.
So, nakita yung naka-assign. Sige. For group 1, can you choose numbers? We have groups. Nakikita ba ninyo sa screen? You can choose one number from that. Sino tong si Dr. Rosalem? Can you see it? Who's the leader for group 1? Hello? Hello? Hindi ko na kayo marinig. Hello? From group 1, hindi ko kayo marinig. Class. Is it the signal?
Hindi po ata, wala po ata nagsasalita ng group 1 leader.
Ha?
Wala pa po nagsasalita ng group 1 leader.
Ano? Wait lang. May wala bang group 1 dito? So, hindi po masyado nakagitna yung paper. Okay. Here. Sinong leader ng group 1? Can you see it? You can choose one number lang. Hello? Bakit wala na? Wala bang group 1? 0 na lang sila? Sinong group 1 sa inyo? Gulo ha? Bakit walang group 1? Hindi ko na. Sige, ganito na lang. Gumawa.
No po, Doc.
Okay, I made two Rolands. Two group of Rolands. So, this would be the group. Diba? You were group as 1 to 10. Diba? Then I'm going to pick one for the group to be asked, and then for this lalagyanan, so I'm going to pick your case for that assigned group. Okay? Para fair. Okay? Is that fair enough? Okay ba yan? So, asan na yung group 1?
Here po, Doc.
Okay na kayo. So, sige. We will redo the picking of group. Okay? So, can you see it? So, be ready. Ha? Did you answer all the cases pala?
Yes po, Doc.
Okay. Sige. So, I'm going to pick which group. Okay. So the group is group 3. Okay. Sino yung mga group 3? Kayo yung unang magdi-discuss. Who's group 3? Group 3?
Doc, kami po.
Okay. Sige. Tapos magpipick na ako ng case ninyo, ha? Okay? Can you see it? To be fair. Sa lahat na lang. Case number 2. Ay, 21 pala. 21. Case 21. So, case 21 is case number 3. Okay? Ito. Yan, ha? Nakikita ninyo? So, your case is about pain management. Okay. Can you read it for the case 3? Group 3?
Yes po, Clara. We'll start po. For case 3, a 75-year-old man abandoned by his family, non-hypertensive, maintained with amlodipine 5 mg tablet, 1 tab a day, has a 2-year history of lower back pain which sometimes radiates down his right leg. He reports that he had a back injury 5 years ago, but his doctor cannot see anything unusual on his x-ray. The vital signs are BP of 120/80, heart rate of 100, RR of 20, temperature of 37, and the pain scale of 3 out of 10.
Okay. So, what's the question number 1? Can you recognize?
So, first is ask if the patient is in pain. So, yes, the patient has a 2-year history of lower back pain which radiates down to his right leg. And next, we will obtain the vital signs which are all normal to Doctora. We have BP of 120/80, the heart rate of 100, a respiratory rate of 20, and a temperature of 37 degrees Celsius.
Okay. How about the pain scale?
Next, we assess Doctora. So, the pain scale is 3 out of 10. The onset of pain is 2 years ago. The cause is back injury 5 years ago. And the mechanism or type of pain is neuropathic.
Okay. What's the level of your pain? Is it mild, moderate, or severe pain?
We have mild pain to Doctora.
Okay. So how are you going to assess again?
To assess doc, we get the pain score, and then get the onset and the cause and the mechanism or the type of pain.
Okay. So, parang hindi ko na wait na. Is nababasa. Okay, what's your final diagnosis?
The final diagnosis is mild chronic pain, neuropathic pain due to lower back pain, which sometimes leads down the right leg.
Is that the correct diagnosis? Is the pain what's the cost? What are the character? How are you going to characterize your pain again? Is it
Mild,
back through your cause, your mechanism, and your duration? Okay. So what's the duration of your pain? Is it acute or chronic?
chronic,
Again, so it's chronic because
the pain has been there for 2 years.
okay, 2 years na. Okay, and then how about the mechanism of your pain? Is it nociceptive or neuropathic?
It's neuropathic pain.
Okay, neuropathic. Okay. How about the ano na to? The cause? Ay, oo.
Due to a lower back, due to a back injury that happened 5 years ago.
No, di ba? We characterize your pain, your duration, mechanism, and your cause. The cause can be ano, cancer or non-cancer.
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 So it's non-cancer. So again, what is your final diagnosis?
So it's chronic neuropathic pain, not neuropathic, non-cancer. It's pain.
Doc, mild chronic neuropathic non-cancer pain po.
What again? Mild, chronic.
Mild chronic neuropathic non-cancer pain po.
Okay. Okay. What else? Ano pang diagnosis ninyo na iba pa? Ano pang idadagdag ninyo dyan? What else? Is the patient hypertensive or not?
No,
Is it
it's
important?
not.
Doc, controlled hypertensive po.
But are you going to include it or not in your diagnosis? Is it right to include it?
I think so po.
Yes, of course. Diba? Okay, you have to include it because the question asked was final diagnosis, diba? It's not only the pain diagnosis, it's final diagnosis. You have to include it. So you should include hypertension if it's controlled or uncontrolled. Or you can even put the stage of your hypertension. It can be stage 1, stage 2, stage 3, diba? But then your patient has a good control of his BP. So you can just put control. Okay? Naintindihan?
Yes po, Doctor.
Okay. So now, what is your appropriate treatment for this patient?
The treatment can include non-drug treatment can be done asking the patient to rest with alternative heat and ice therapy, and also drug treatment can also be done as the pain is mild. So acetaminophen or non-steroidal anti-inflammatories such as ibuprofen, aspirin can be given.
Okay.
And And as the pain is neuropathic, medications such as amitriptyline can also be given, and physical therapy can also be done, and including exercises, and steroid injections can also be is also recommended. So the uh, next surgical intervention is also done for focus on removal of the disc herniation and eventually part of the disc or on foraminal stenosis with the purpose of eliminating the suspected cause of sciatica.
Okay, you can recommend. What else? What else are you going to include in your treatment? Aside from rehab or physical therapy, can you advise the patient to ask for counseling? Kasi remember, the patient was abandoned, di ba? So, kailangan ba niya ng support group? Does the patient needs support group or not? Since the patient is already abandoned.
Yes po, Dr. She needs po a support group so we can do counseling din po for her psychological needs.
Okay, diba? You have to see to it that all of the needs of your patient would be given, and even the smallest need of your patient should be given. Okay? Kasi psychological effect of treatment is very important. Okay? Naintindihan?
Yes,
So, for the letter E, give 3 possible barriers for this patient for treatment.
It could be patient barriers like reluctance or fear.
Okay, so how are you going to address that? If the patient is fearful or very anxious,
Could educate the patient further by giving him
are you going to tell him it's okay and just
But-
go and take your
by explaining the by explaining what we are going to do, and
what else? What else, Doktora? Ano pa? Ano pa? Joe?
yes,
Are you going to explain the benefits and risks of your treatment? And are you going to reassure the patient about the pain he is experiencing? Okay? Are you going ano? Choppy kayo. What else? Di ba isa pa lang yun? Give 2 more.
it could be due to inadequate knowledge of healthcare professionals and lack of assessment and documentation.
Why? Are you sure if that the treatment and the medical team are not that knowledgeable? since the patient's hypertension is already controlled, so maybe the medical team are good enough to treat the patient. Give you the idea na nga. So aside from explaining the patient of the benefits and risks of your treatment, what else? Bari, assurance. It's not that ano na to, ay, yung one of the barriers could be ano pa, di ba walang support yung pasyente?
Yes po, Doc. And he is also 75 years old, so Dr. he may not be able to comply with the medications kasi if we use pain medications, it should be taken around the clock, so we will not wait for it to be painful for the next dose po.
Okay. What else? Can you give all the drugs that you have mentioned for this patient? So remember, class, that you have to tailor all the treatment of each of your patient per patient. So individual. Okay, it cannot be given to this patient and then you can give to another patient. No, it should be tailored to the patient piece. Okay. What else? Can you give the medications, all the medications that you have mentioned? The amitriptyline, the anti-inflammatory drugs. Can you give it all? Remember, your patient is 75-year-old man. So is the kidneys of this patient is still normal?
For this patient, I think it's best to give first because the pain is only mild. We can just give for the safest drug, acetaminophen po.
Okay. Can you give it full dose or not?
500 milligram, I think is good enough, Doctor.
Okay. So you should remember, if you can compute it, then compute it. If not, you have to start from the lowest dose, then going up, titrating upward, going up to the dose that the patient would have good response. Okay? Naintindihan?
Yes po, Doctor.
Okay na. Very good. Group 3.
Thank you po, Doctor.
But you have to read more.
Yes po.
Okay? Next, para matapos na tayo. At, excuse me, Dr. Elijah, may class pa ba kayo after 9 p.m.?
Check ko po ulit yung schedule, but I think ito na po yung last.
Okay, sige. Sige. Okay, bubunot na ako ha. So, the next group na magdi-discuss is Group A. Group A. Sinong mga Group A? Group A. Sino yung mga
Good evening po, Professor.
Okay. Kukuha na ako ng case ninyo. So, case 56, which is case number 8. Nakikita niyo? Group 8, case 8. So, nandyan kayo. Huwag ninyong isusulat yung absent na classmate ninyo, ha? Ay, asan na nga ba? Case number 8. Okay. Case number 8, Group 8. Can you read it? Sinong leader ninyo? Case 3.
So for so for the case number 8, we have a 46-year-old female who's found unresponsive at
Patibasa, can you read the case, group 8?
for the case number 8, we have a 46-year-old who is found unresponsive and has to leave. For the number 1 slash 1 step number 2, can you do it?
Okay. So what are you going to do? You found an unresponsive 46-year-old female, not breathing. So, tatakbo ba kayo? Are you going to help the patient?
First, we must assess the environment or where the patient resides is safe to walk.
And
Then we assess for the consciousness of the patient.
the patient is unresponsive.
We check for the airway and breathing products simultaneously.
Okay, how are you going to check for the consciousness of your patient?
We would have to tap the patient's shoulder and say, hey, are you okay, doc? Hey, are you okay?
On both sides or one side?
Both sides of the shoulder.
Okay, and then
after doc, we assess check the CAV of the patient.
so how are you going to check it?
By checking the carotid pulse of the patient would checking the rise and fall of the chest of the patient.
Are you going to check it while you are checking for the pulse or not?
From what when I had my seminar, you could check it simultaneously for to lessen the to lessen the time that the patient is having if the patient is a bit of lack of circulation, so that's higher in the system.
So how are you going to check for the pulses? Are you going to put it? Are you going to check it on your antecubital area or what?
We put our pointing fingers and middle fingers to the patient's carotid area and assess it for less than 10 seconds.
Remember, it should be less than 10 seconds. And as early as 5 seconds, you should know na kung yung patient is pulseless or not. Okay? As early as 5 seconds. Okay. So, now the patient is unresponsive. Is she conscious or not?
Since the patient is unconscious and not breathing,
So, after 5 seconds, sabi niya dito, after 5 seconds of checking your carotid area, your pulse rate is 0. So, what is your best management?
we start with the compression immediately to
Now, what is the characteristics of your high quality CPR again?
Since the patient is a 46 years old, then we must deliver the compression with the ratio of 6 to for ratio of circulation. Since the patient is a 46-year-old female, for the default compression for the population, 5 centimeter.
Okay. What else? Give all the characteristics of good quality CPR.
First, we must look the where we are going to put our pump for the compression.
Okay.
After
And then,
we
how
push
fast
hard.
do your compressions?
According from the discussion for the last week, it should be 100 to 120 compression per minute.
And then what else are you going to observe to give high quality CPR?
We must allow that just to completely recoil, and also we should minimize the impact of the compression within less than 10 seconds.
Okay. And are you going to ventilate the patient or not?
I think we should ventilate the patient since the patient is active.
You should ventilate the patient first. But initially, before assuring that the patient has no pulse, you have to ask for help. Okay? Diba? Sabi natin, you have to ask first for help. Kasi hindi mo si CPR, hindi mo marirevive yung pasyente all by yourself. Okay? Kailangan mo nang tutulong sa'yo para mag-CPR and i-revive yung pasyente. Okay. So, what if wala kang face mask? How are you going to do the ventilation? Again, how many ventilations again? Hello?
There should be at least 100 to 120 compressions per minute.
That's the compression, di ba? But the ventilation, how many ventilations for every 30?
For every 30, for every 30 compression, the doctor should be two breathing.
Okay. Anong gap niya? So you should remember it should be the ventilation should be given 5 seconds, no? So ventilate and then after 5 seconds then ventilate again for 2 ventilators. So you should remember 30:2. Okay? Ano na yung tanong ko? So how are you going to perform your ventilation? Are you going to put your mouth on your patient's mouth? Lalo ngayong pandemic. Are you going to do mouth-to-mouth resuscitation? Remember, your patient is stranger. No, diba? So how are you going to do it? If you have tissue na medyo may mesh ng konti, then you can put that tissue and then you should, for example, this is the mouth. Can you see me? Can you see me? Hello?
Yes.
So, for example, this is the mouth. You can put your hand here, and then your hand there, and then blow it. Okay? It's like ganyan. Basta walang leak. Okay? And then blow it. For you to protect yourself. Okay? Para hindi ka mahawaan kung ano man yun. Pero now, this pandemic, it's not advisable yet. Okay? We have also face masks. And, yung face mask na ganito, and then we usually use it for CPR, resuscitation. Pag mayroon kang ganyan, and then you just put the mask sa mouth ng pasyente and then blow it. Okay? Naintindihan? Okay, next is, what else? Tapos na tayo sa high quality CPR. For question number 3. Hindi. No. Still number 2. So after doing your CPR, the help is already here and the medical team is already has already arrived. So what are you going to do? Can you still continue doing your CPR?
Yes, while probably while nursing the patient to the healthcare and the emergency provider, we should still continue to that second pressure.
Okay. Pero after 2 minutes of doing your CPR, can you still continue it? Are you going to continue it or not? Or can you give any medicines? Hello? Hello?
Yes, po, Doc. So we can, since we have the medical teams on their hand, we can give epinephrine.
At what dose? Ba't mag-isa mo lang na nagsasagot? Asan yung ibang groupmate mo? Pwede bang tumulong yung ibang groupmate? Bilisan natin. What dose of epinephrine? You should know the dose of your epinephrine.
For the dose of epinephrine, 1 milligram,
Okay, and then,
and flush 20 cc of plain NSS.
okay, but before that, you should insert first your IV line. So where are you going to put your insert your IV line? Ang bilis-bilis lang doon. Saan? Saan ninyo i-insert
Sa
yung
arm,
IV?
pwede po sa sa hand po, Doc.
Saang bandang hand?
Sa back of the hand po. Or pwede rin po sa antecubital fossa through the MCV po.
Sa antecubital area.
Yes po.
Ito. Ay, naku, hindi ka nakinig sa lecture, no? So, this is very accessible. Okay? Just insert your IV line here. Kasi this is very accessible vein. Okay? After inserting your IV line, then you may give your epinephrine. Then flush it with your 20 cc of plain NSS. So after flushing it, are you going to elevate the IV site or not?
Elevate po, Doc, so that the drug will flow to the heart.
Okay. Are you going to give your drug during CPR or after CPR? During compression or not?
During the compression po, Doc.
Okay. Why? Yun, sinagot mo na yung kanina because
Yes po, Doc, para mag-flow po yung drug to the heart.
okay, sige. So after the medical team has arrived, ECG reveals ito, this ECG tracing with no pulse. So what's your diagnosis?
For the tracing po, Doc, atrial flutter.
Okay, atrial flutter. So what is the best management for this tracing, this diagnosis? Are you going to continue your CPR?
Since atrial flutter is a shockable rhythm po, Doc,
Okay.
probably we can uh, we can use our defibrillator.
Okay. Tama. As soon as meron ka ng defibrillator, you have to give your shunt as soon as possible. Okay, if the case is shockable. Okay, and then after giving your defibrillation, at what joules? How many joules are you going to give if the patient, if your defibrillator is biphasic?
$200 joules.
200 joules ba?
Uh, 306. Ay, 200 biphasic.
Ano, biphasic?
200 joules.
Sigurado?
Yes, 200 joules po, yes po.
200 joules pag biphasic. Pag monophasic,
For monophasic, it's 360 joules po.
na doon sa PowerPoint. Tama?
Yes po.
Okay. So after giving your defibrillation, what else are you going to do? Na-defibrillate mo na. So are you going to give your drug now?
Assess the rhythm ulit.
No, you have to resume CPR. Okay, after giving your defibrillation, you have to resume CPR. Remember, kinoriente mo, ganito yung heart mo, gumaganyan-ganyan, di ba? And then, kinoriente. So, nag-stop yung heart. So, are you going to pump it on itself? No, di ba? So, you should help the heart to pump again. So, you have to give your CPR, your compression. Okay, you have to resume compression again. And then after that, after 2 minutes of doing your CPR, that's the time you're going to do your SAS. Okay? Your stop, assess, and then shift. Okay? Naintindihan? Hello? If the rhythm is still atrial flutter, anong gagawin mo next? Pagka-assess mo, nakita mo yung monitor, still atrial flutter. So, anong gagawin mo? Are you going to give your drug? Or CPR again? Or shock again?
Shock again po.
Okay. Kasi it's still shockable rhythm. So, you should give defibrillation. Okay? Then, for the question number 4, after 2 minutes, ECG reveals this one. So, with no pulse, huh? So, what's your diagnosis? Sino yung ibang ka-group mo? So, diagnose it?
Vita po.
Okay, Vita. Is it pulseless or with pulse?
Pulseless.
Okay. So, if it's pulseless, is it shockable or non-shockable?
It's shockable.
So, what's your treatment or management? So, diba may notes na kayo niyan? Na-answeran na.
Pulseless.
So, if it's pulseless, Vita, are you going to give defibrillation again? Or give CPR? Or give drugs?
The drugs will be available if the beta is with pulse. So for this patient po, Doc, I think it would be best if we resume our CPR and then we
Diba
shock.
are you going to give CPR or shock once you have assessed that your ECG tracing is Vita with no pulse?
We shock again.
Okay. Remember, you should remember, once your rhythm is shockable, then give defibrillation. Shock the patient agad. Okay, after shocking the patient, resume CPR. Okay, and then after 2 minutes of doing CPR, then you have to do your SAS. Then after SAS, after assessing the patient and knowing if it's shockable or not, then you can give your proper treatment. Okay. So for the question number 5, after 2 minutes of ECG, of doing your CPR after shocking, di ba? Nag-shock ka, and then after shocking, do your CPR. After 2 minutes, your ECG reveals this one for the number 5. Question number 5. Okay? No pulse. The patient has no pulse. So what's your diagnosis for this one?
Ventricular fibrillation.
Okay. So since it's ventricular fibrillation, is it shockable or not?
It is shockable.
Okay, it's shockable. Then the treatment should be anong treatment niyo? Can you now give your drugs? Or not? Can you give defibrillation again? Hello? Tandaan ninyo, that's why you have to diagnose. Diagnose first before treatment. Okay? So, since your diagnosis is shockable rhythm, then your treatment should be shock also. Okay? Defibrillation. Hello?
Ayos po.
So, defibrillate the patient. After defibrillation, then resume CPR. And then after 2 minutes, stop, and then assess, and then shift. Okay? Mag-exchange yung taga-CPR and the taga-ventilate or kung sino man ang ka-exchange niya para hindi ma-exhaust yung nagko-compress. Okay? Just compress. Naintindihan? Naintindihan, class? Okay. And then after 2 minutes, ECG reveals this one. So, what rhythm is this one? Hello? Anong rhythm na ito? Is this abnormal rhythm or normal na?
Normal na po.
So it's normal sinus rhythm. So what are you going to do? What's your next step after checking your monitor? It's now normal sinus rhythm. So are you going to leave the patient, or are you going to be happy that you have revived the patient, or you're going to confirm it first? Hello?
Confirm the rhythm po.
So how are you going to check the rhythm to confirm the rhythm? So kukuha ka ulit ng isang monitor pa. Baka naman nagkakamali itong monitor na to. Hindi totoo. So ano ang pagko-confirm mo na totoo na revive na yung pasyente? So you have to check the pulse. Okay? Check yung pulse mo sa carotid area. Baka naman ito PEA, pulseless electrical activity lang. Baka hindi pala ito normal sinus rhythm. So you have to check. Okay? Check for at least 5 seconds for your carotid pulses. If meron ka ng pulses, then totoo itong nasa monitor mo. Remember, you should not treat the laboratories, the monitors. You should treat the patient according to your physical examination. So what are the physical examination that should be done? It includes your palpation, your auscultation, your sight. You should know how to look at the patient's color, patient's face, patient's climates, those ones. Okay? Hindi yung laboratories ng pasyente, hindi yung monitors na nakakabit sa pasyente, hindi yun. Dapat kino-confirm ninyo on your own hands, your own ears, eyes. Okay? Naintindihan? So you should confirm first. You should check if the pulses is already mayroon ng pulses. So through your carotid artery, and then for at least 5 seconds. Kung meron kang pulses, then the patient has revived. Na-revive mo yung pasyente. Sa kanang to talaga. Okay? So, Since the vital signs is already 70/50 for your BP, heart rate of 40, RR of 4, O2 sat of 89%, GCS of 3/15 with prominent jugular vein. So what's your diagnosis? What's your diagnosis now? Class? Ano na? Anong diagnosis na ninyo? Aside from normal sinus rhythm na yung pasyente ninyo.
He is also bradycardic.
Okay. What else? Is the patient has the patient not with normal O2 sat or not?
Not normal. Normal also.
Saturated. Okay. Hypotensive din ba yung pasyente? No.
Hypotensive din.
Okay. Okay. So, pero may pulses ka. Right?
Yes po.
So, are you now at your ROSC or has the patient returned to circulation already? Nasa ROS ka na ba? Yes, di ba? The patient has already returned to systemic circulation, di ba? So, in short, na-revive yung pasyente. Tama? Tama ba? Give 3 possible reversible causes of arrest for this patient. Class. On next group mate. Give 3 possible reversible causes of arrest for this patient. Can anyone give 3 possible causes of arrest?
For the reversible causes, we can the 5Hs and the 5Ts.
Okay. Can you give 3 possible causes of arrest for this patient, ha?
So, hypovolemia,
Hypovolemia.
hypoxia,
Pwede. What else? What's your PE? Is the prominent jugular vein significant?
yes po, tamponade.
Okay. So, cardiac tamponade. Okay. So, you should be very observative for each patient. Kasi tingnan niyo may prominent jugular vein. Baka may cardiac tamponade yung pasyente ito, kaya siya nag-arrest. So, you should address that. You should treat the cardiac tamponade. Okay? Okay. For the question number 8, what are you going to do once patient had returned to spontaneous circulation? So, for A, are you going to intubate the patient or not? Since the patient is already breathing, pero 4 lang.
Intubate the patient since the RR is only 4.
Okay. So, intubate the patient. So, how are you going to confirm? What is the primary confirmation of your intubation? Kung intubated ka dun sa trachea or sa esophagus.
For primary confirmation po, we can have the 5 points of auscultation.
No, the primary confirmation is the ETCO2, di ba? You should check the capnography of at least 2 waveforms. Meron ka ng 2 waveforms, then the probability that you have inserted your tube correctly is very high. Okay, and then the secondary confirmation is the 5 points of auscultation, which is the you're going to auscultate first the epigastric base and then base and then the apex, diba? So you should remember your primary confirmation of airway is your ETCO of at least 1. Anong ETCO2 of at least nandyan sa notes ninyo? Diba sinulat natin?
Greater than 40 millimeter mercury.
Yung range is 35 to 40 millimeter mercury. Okay? 35 is okay na. Okay? Ay, ang nagkabalik na dito, your primary confirmation should be may ako pala. Tama yung sabi mo pala. Sorry. Primary confirmation is your 5 points of auscultation, and then secondary is your waveform capnography. Okay? Sorry. Okay? And then, what else are you going to give? Is the patient stable or not? For the C, di ba? A, B, C. Last. Your PT is 70 over 50. Is the patient stable? Stable ba siya o hindi?
Unstable.
Unstable. So, what are you going to do? Can you give now hydration, such as plain NSSR or plain RS?
Yes po, as well as pressors.
But remember, your jugular vein is prominent.
Yes po.
You are considering cardiac tamponade. Can you give your hydration?
Probably for this patient, we can just infuse your dopamine.
Okay, at what dose?
2 to 20 microgram per kilogram per minute.
Okay, you may start dopamine kaagad. Kasi you are entertaining cardiac tamponade for this patient. You cannot give further hydration. Remember, your dose for your volume is 1 to 2 liters. Imagine mo, 2 liters ang ibibigay mo sa pasyente. So, magka-cardiac tamponade pa siya further. Okay, it's contraindicated for this patient to give more hydration. Okay? Okay. What else for the T? Is the patient comatose or not? Anong GCS niya ulit?
Triple.
So, the patient is considered as?
Comatose.
So, what's your management?
The goal is to maintain the upper body temperature.
So, how are you going to, what body temperature again?
32 to 36 degrees Celsius.
For at
For at
least?
least 24 hours.
So, how are you going to maintain the targeted temperature?
By giving 30 ml per kilogram of cold 4 degrees Celsius plain NSS or plain LRS IV bolus to run for 30 minutes.
Can you do it for this patient again?
No po, Doc, since there is the risk, there is the threat of the cardiac crackle.
So how are you going to do, how are you going to get your temperature target of 32 to 36 degrees Celsius? Paano mo palalamigin yung pasyente? So, what you're going to do is put some ice pack on the axillary areas. Okay, hanggang ma-achieve mo yung 32 to 36 degrees Celsius na temperature ng pasyente. Or, keep the room cooler. So, i-kuan mo lang, colder mo lang para ma-maintain mo yung body temperature at 32 to 36 degrees Celsius. Naintindihan? Or lavage the patient with cold plain LRS. Ibig sabihin ng lavage, you just put NGT and then put the cold plain LR or plain NSS and then remove it after giving it in. Okay? So, parang pinapasok mo and then pinadaan mo sa tiyan lang and then i-remove mo pa rin. Pero that's very risky. So, para hindi masyadong risky, just put some ice pack on the axillary area and at the groin areas. Okay? To maintain your targeted temperature. Okay. For your post-arrest care, so what are you going to insert or give, or what are the management are you going to do to this patient? Class, nakikinig ba kayo? Hello? Parang ang tagal-tagal. Okay. Salamat, Dr. Laluan. Okay. So, anong gagawin mo sa post-arrest care? Group A. Are you going to transfer kaagad-agad yung pasyente sa ICU?
Insert ET tube po, Doc.
You already have inserted your ET tube. Kasi di ba sa A, naka-insert ka na. Intubated na yung pasyente. Kasi kanina, di ba?
Okay po, Doc. Sorry.
Sa post-arrest care na tayo. Ano yung NGT? Nasogastric tube. Okay? Hindi ET tube. What else? What else? Bilisan ninyo. Group A. Kasi pangalawa pa lang kayo. What else?
For the post-arrest care po, Doc, insert NGT, your CVP po, and your IFC, your intrafolio catheter po.
Hmm.
And
And
then,
then?
obtain portable chest X-ray, as well as your 12-lead ECG.
Okay. After that,
We transfer the patient to the ICU for close monitoring.
and can you refer him to the intensivist? Pwede, di ba?
Yes po, Doc, refer to intensivist.
So, pwede ka na bang umuwi pag ganyan? Na-refer mo na sa subspecialty. Pag ikaw yung doktor.
Yes po.
Okay? Ang tagal ma-revive yung pasyente ninyo. Buti hindi siya namatay. Okay? So, you should remember your algorithm palagi. So, initial impression, you should know if the patient is conscious, unconscious. If conscious, ACLS, unconscious, BLS. Okay? And then for the ACLS, primary, secondary assessment. Okay? Tapos yun na. Titingnan mo lang kung shockable or unshockable yung pasyente. If it's shockable, then do defibrillation. If non-shockable, then do CPR. Okay? And then after reviving the patient, you're now at the ROSC, then ABCD. Okay? Airway, blood circulation, RR, tapos for the T, temperature and GCS. Okay? And check for any disability of your patient. Okay? And then after that, do your post-arrest care. And then transfer the patient and refer it to specialist. Okay? Yun lang, ganun lang ka-easy yung class. No? Okay? Thank you, Group A. Pero review pa ha, kasi marami pang hindi pa masyado. Pero naiintindihan ko naman yun. Pero at least, meron naman kayong konting idea. Okay? Naiintindihan ba, class?
Yes.
Sige. Basta makinig lang kayo. And then, in every case na i-discuss natin, I hope na may matutunan kayo. Kasi every case, every patient, magkakaiba-iba yan. Okay? So, hindi kahon ang treatment ng mga pasyente. Okay? Okay, next group. Bilisan na natin. Group 10. Sino ang group 10? Group 10. Nandiyan na ba ang group 10?
Good evening po, Doktor.
Good evening. Ito ang case ninyo. Bilisan na natin. Case 110. So, 110 is case number 4. Okay? Sige, basahin niyo yung case 4. Basa ng case 4. Okay. Case number 4. Can you read it?
We have a patient, a 23-year-old female, known asthmatic, has had a severe injury to her right leg leading to a surgical below knee amputation 6 months ago. Her vital signs is BP is 100 over 70 millimeter mercury, heart rate is 102 beats per minute, respiratory rate is 32 CPM with wheezes, temperature is 36.8 Celsius, pain scale is 6 over 10, and patient is very anxious about the side effects of any drugs.
Okay. So, recognize? Do recognition. So, ano? Is the patient in pain?
Yes po, Doc.
Okay. What's the level of your pain? Of her pain?
Ano po, 6 po. It is moderate pain. So, since it is moderately strong pain, it interferes with its normal daily activities. It has a difficulty in concentrating po.
Okay. Which explains also that the patient is very anxious then. Okay?
Okay po, Doctor. Thank you po.
Okay. And then, so now let's assess. Okay, how are you going to assess the patient?
By,
First, for the
sorry
duration.
po, sorry po.
Sige. Ikaw muna.
May apologies po, Doctor. So for assessing the patient, we should get its vital signs po.
Okay.
Opo.
Vital signs. Okay. PE. Okay. So since the vital signs are 100/70, heart rate 102, RR 32, temperature of 36.8, and pain scale of 6/10. So ano pa? What are the other salient feature of this patient or remarkable findings?
The severity of the pain. Ay, meron na po pala, severity of the pain. The pains,
Severity.
severity of the pain, it's 6/10 po.
6/10, so moderate, di ba?
Opo.
What else? Ano pa yung remarkable findings of this patient? The patient is asthmatic, di ba?
Yes po, Doc.
Okay.
That's for the other factors po. Anxious of the patient.
Okay. May
Anxious.
wheezes din, di ba?
Opo.
Okay, malamang-lamang in acute exacerbation tong pasyenteng ito.
Yes po.
Okay. So now, you already have do your PE. What are the other things that should be assessed?
For the history of amputation po, I think 6 months ago.
Okay.
Yes po.
So how are you going to assess again for your pain? So you should know first your yung characteristics of your pain. So how are you going to characterize your pain? So duration, mechanism, and cause. So for the duration, is it acute or chronic?
Chronic po, Doc.
Dahil
Since it is more than 3 months po. Yes, a history of 6 months ago po. More than 3 months na po kasi. Opo.
so it's acute. Okay. For the mechanism of your pain,
It's neuropathic po, Doc. Since it is caused by the damage in the nervous system and effects of the nerve damage po.
okay. And then what else?
Non-cancer din po, Doktora.
Cancer. So therefore, your final diagnosis is
Chronic non-cancer neuropathic pain po. Is that right po?
how about the moderate? Are you going to include the moderate pain?
Ay, oo nga po pala. Po.
Again, what's your final diagnosis?
Chronic neuropathic pain, non-cancerous, moderate pain po. Tama po ba?
So the right, yung tamang pag-diagnose is chronic, neuropathic, non-cancerous, moderate pain. Mas maganda yun na pakinggan. Pag pangit pakinggan, hindi yun. Pag mas maganda yun.
Thank you po,
Okay?
Doktora.
So, what else? Ano pa yung isa pang diagnosis mo? Ano pa? Are you considering any phantom limb for this patient?
Yes po, Doc, since na-amputate, since the patient has amputation po pala before.
Yes. You should put there to consider phantom limb. Or, yun, chronic, neuropathic, non-cancerous, moderate pain, secondary to, or, secondary to phantom limb. or comma, to consider phantom limb. And then, what else? Ano pa ang ilalagay mong diagnosis mo? Is the history of asthma very important?
Yes po, Doc.
So, ilalagay ba natin sa final diagnosis or not?
Yes po.
So, what's your diagnosis for bronchial asthma? With wheezes.
Bronchial asthma po in acute exacerbation po ba, Doktora?
Okay, so ano yung final diagnosis for the complete diagnosis?
Wait. Chronic neuropathic non-cancerous moderate pain, secondary phantom limb pain din
To consider phantom limb.
to consider po. I'm not sure if it's secondary to bronchial asthma po in acute exacerbation. Since since the asthma is po.
Ibang disease entity yung bronchial asthma.
Okay po.
Okay? Hindi secondary. So, kung ibig sabihin ng secondary to, ibig sabihin yung asthma ang nag-cause ng pain niya, no? 'Di ba? Hindi pwede. So,
sorry, kabado lang.
Different disease entity. So, should be chronic, neuropathic, non-cancerous, moderate pain, tapos, to consider phantom limb, bronchial asthma in acute exacerbation.
Thank you po, Doctor.
Final diagnosis. Now, what's your appropriate treatment for this patient?
We should explain to the patient that it is normal to still feel the pain even if it's amputated po, since the patient has phantom limb pain po. And then we should reassure the patient that this is very manageable, and having a counseling non-pharmacological ways like in managing this pain, such as massaging the residual limb or having a virtual reality therapy, mirror box therapy, repositioning of the residual limb by propping on a pillow or cushion, and we can also tell the patient have some music therapy so that the patient cannot feel it's amputated limb po because yeah. So
what else?
Sorry po.
Sige.
We can also give for the patient drug treatments like over-the-counter drugs or OTC, like what do you call that? Acetaminophen or Tylenol. Same lang naman ako. Ibuprofen like Advil or naproxen sodium po, Doc, like Aleve may relieve the phantom limb pain, and we can also give the patient anticonvulsants like gabapentin, since na parang may tusok-tusok, tingling po yata yun. And then pregabalin as well.
One lang.
Okay po, Doc. Sige, thank you.
Parehas yung pregabalin and gabapentin. Parang magkapamilya sila. So you should know also kung magkapamilya ba o hindi. Kasi you should weigh the benefits over the toxicity of your drugs. Okay? Sometimes kasi, remember, the patient is asthmatic, anxious about the side effects of of the drugs that can be given to her. So, dapat isa lang as much as possible. If the benefits is benefits of giving one drug only, then give one drug lang. Okay?
Thank you po, Doctor.
This patient, kasi very anxious na siya.
Thank you po.
Okay?
Apo.
Okay. Mayroon pa bang ibang gamot?
That's the only two drugs po that I know because I only based on experience because when I feel tingling, they give pregabalin.
Okay.
Okay.
So why?
There's
Meron ka ding nerve injury?
hindi naman po.
Okay.
Before lang po. That's why
Okay.
I put pregabalin.
And also pregabalin would cause sleepiness. Okay? So you should give your pregabalin at bedtime. Better to give it at bedtime. Para mas makatulog yung pasyente and mas makalma. Okay? Kasi itong pasyente ito, very anxious.
Yes po, Doctor.
So you have to consider also for the cost of your drugs. Yung gabapentin, ang alam ko mas mahal kaysa pregabalin.
200 pesos po yata yung pregabalin.
Yung about the gab, it's masyadong mahal. Remember, your patient is only 23 years old. So baka very dependent pa to sa mga magulang niya. So wala pa siyang work.
Yes po.
Okay, asthmatic pa siya. So ang dami niyang maintenance.
Apo, Doctor.
Okay? Hindi yung porke doktor kayo yung gusto mo na gamot. Hindi. You should consider also your patient's yung sweldo niya, yung pera niya, kung paano niya mapupurchase, gano'n. Porke gusto mo ito, wala naman dun sa pharmacy. But huwag mong ibigay. Okay? Then for the E, question number E, give 3 possible barriers of treatment for this patient.
When having uncooperative patient to treatment regimen po, Doctor.
Okay.
And then you should consider the what they call that, the patient's emotional state. Yes, in our case it is anxious, so that the patient may not fully explain or describe her pain, and the patient may be poorly understood instructions and will not follow therapeutic regimen as prescribed. Like I said, the patient is anxious, and then since the patient is asthmatic and its vital signs is having 122 beats per minute and its respiratory rate is 32 cycles per minute with noted wheezes. So I think po, Doc, some medications are contraindicated to unstable patients. For example, we call that TCAs like tricyclic antidepressants are contraindicated to patients who have arrhythmias po, Doctor.
Okay. And also, another question for letter D. For the treatment for this patient, what else are you going to give pala? Aside from your treatment sa pain, are you not going to give your anti-asthma medication?
Yes.
So since the patient is in acute exacerbation, you should also address that. Okay? Wala ngang pain yung pasyente, namatay naman siya sa asthma.
Yes po, Doc. I'm not sure po. Can we give albuterol 2.5 milligrams by nebulizer po, Doc?
You can.
Okay po. Yun po.
The patient is slightly tachycardic lang. Di ba?
Yes po.
Pag yung mga side effects ng mga anti-asthmatic drugs mo are tachycardia. So you should also watch out for tachycardia. Pero 102 is okay lang naman. Okay? Naintindihan?
Okay. Okay lang po magtanong, Doc.
Okay, sige.
Can we give prednisone po for acute exacerbation? I'm not sure po kasi.
Sa aking palagay, no. Ay, sa iba, pwede. Kasi yung more on prednisone sa chronic. Okay? Pero, yung iba, ini-start na nila. And then, itutuloy nila after 5 days, tinutuloy nila up to 2 weeks. Pero depende.
Okay.
Pero for acute exacerbation, pag binigyan mo na siya ng inhalation, yung pausok, the patient may be relieved naman.
Kasi Doc,
Pag
since...
hindi,
sorry.
pag chronically nagkakaroon ng asthma yung pasyente, better to give prednisone. Pero kung ngayon lang nagkaroon ulit, yung pang-acute treatment lang.
Okay po, noted po.
Okay?
Apo.
Okay, very good. Group 4.
Apo.
Ay, group 10 pala. Group 10.
Complete attendance din po pala, Doc. Thank you po.
Okay. Yung mga attendance ninyo ha, sinasabi ko na sa inyo para hindi kayo malugi. Kung sino yung wala, huwag ninyong i-include. Kahit na sabihin nung friend mo na absent ngayon, na ililibre ka niya ng Starbucks, wag pa rin. Luging-lugi ka.
Okay
Tsaka
po, Doktor. Noted po, Doktor.
Okay. Okay, very good. Next, group. Group 5. Saan ang group 5? And for the group 5, ang case ninyo is 61. 61 is case number 6. Number 6. So, group 5. Okay, asan na yung group 5?
Hello po.
Tapos, sana matapos natin. Mabilis lang
Hello.
naman.
Can you hear me?
Okay, hello. Sige. Your case is case number 6. Okay. Sige, basahin ninyo. Pakibasa.
We have a 50-year-old male came in at the emergency room with a chief complaint of dizziness. Initial vital signs was 120/80, heart rate is 54, RR21, autostat is 92, no pain noted. So, po Doc, diagnosis initially po Doc.
What is the most appropriate thing to do? The patient came in, doktor, nahihilo po ako.
Po Doc. Pahigain. Pahigain siya sa hospital bed.
Okay. Okay, salamat po sa pagpahiga sa akin. Ano na pong next ninyong gagawin, doktor?
I-do a thorough history and physical examination po Doc.
Okay.
Of the dizziness.
Nahihilo po talaga ako.
I'll ask whether the dizziness is rotatory po.
Hindi naman po. Basta nahihilo lang ako.
And I'll ask if she has any other comorbidities like heart condition or she's taking any medications.
Doktor, yung autosat ko 92% lang.
Autosat, give oxygen po via nasal cannula at 2 to 3 LPM.
2 to 3 LPM nasal cannula. Okay? Ano pa? What else? Ano pa yung, di ba, after doing, di ba, for the primary assessment, what are you going to get for the primary assessment?
Visualize po Doc, whether the patient is conscious, breathing, and the color of the skin po Doc.
So, is the patient conscious?
Yes Doc.
Yes, kasi nagko-complain ka ng dizziness, di ba? Is the patient breathing?
Yes Doc. And the color po.
The color, is the patient's color cyanotic?
Probably cyanotic Doc because of the autosaturation.
40 lang, di ba? 92%. But then, you already have addressed that by giving nasal cannula at 2 to 3 LPM. So, what else are you going to?
Next will be the vital signs, the airway.
Yung signs na natin, yung BP 120/80, mga ganon. So, done na yun. Ano pa? Verbalize.
Airway. Verbalize sample.
Okay, so how are you going to?
Signs and symptoms. We'll ask for any associated symptoms po. If there is any vomiting.
Wala naman akong pagsusuka.
Nausea. Or ringing of the ear.
Wala naman po.
Or lightheadedness.
Yun, kaya ako nahihilo kasi feeling ko magaan yung ulo ko.
And allergies po, Doc.
Okay, wala naman po akong allergies.
Medications taken.
Uminom lang ako ng paracetamol.
So, she's experiencing headache.
Ano na?
Headache po.
Wala naman. Gusto ko lang uminom ng paracetamol.
Medical, any history of hypertension po, Doc? Or diabetes?
Naman po.
What was the last meal?
Mga kaninang alas 8 ng umaga.
Anong oras po siya dumating? Gabi na.
Ngayon.
Ngayong gabi. So, tinolerate. So,
Okay.
then the events. So, ano po yung ginagawa niya prior to the dizziness?
Naglinis ako ng bahay. Okay, that's your primary assessment.
Kwan na po yun, Doc. Verbalize is our secondary.
Nasa secondary ka, pero nasa V ka pa rin, di ba?
Opo, Doc.
So, and then, your O,
Oxygenate. I gave that.
your nasal cannula, di ba? Oxygenate. And then M,
Monitor, Doc. I'll check the ECG or hook to a cardiac monitor po.
ano na yung monophasic ECG? Where are you going to hook your white lead?
White lead po, Doc, sa right side of the second intercostal midclavicular line. Then the black to the left and red to the rib for the apex.
How about if biphasic?
Biphasic po, lead color red is right, yellow is left, green is ribs.
Okay. Then after that,
And we can insert the IV.
so pag
Monitor.
kaya na ninyong mag-insert ng IV, mag-insert na kayo before pa magkaroon ng hypotension or anuman. Okay? Kasi if your patient is already hypotensive, it's hard for you to access any IV line. Kasi collapse na yung vein pag hypotensive ka. So maglagay ka na kahit naka-standby ka lang. Okay, what else?
After inserting IV po, Doc, we need to treat the patient na. But for now po, I think we need to observe the patient.
Kasi your diagnosis is?
My initial DX po, Doc, is probably I'm suspecting of cardiac arrhythmia.
Arrhythmia. Wala ka pang monitor.
Kaya nga po.
Wala pa tayong ECG.
Vertigo na lang. My second DX is vertigo. And
Pwede.
and we consider syncope.
Pwede. Pero the very obvious na problem ng pasyente is your heart rate normal.
Bradycardic po siya.
Okay. So, bradycardia. Bradycardia. What else?
Cardia hypoxic.
Hypoxia. What else? To consider vertigo. Diba? Kasi dizziness lang, diba? Tama?
Apo.
Okay. And then, your management again?
Management po. Observe po.
But the patient is symptomatic.
Treat the dizziness po, no? And
So, how are you
observe
going to
yung heart rate. Monitor the heart rate.
Pero dizzy ako. What are you going to give for dizziness again?
Dizziness. Sa case na to, doctor,
Kahit na ano.
Sinarisin.
Pwede. Pero after giving your sinarisin, wala pa rin. Dizzy pa rin ako, doktor.
ECG po, no?
Wala pa rin yung ECG, doktor. Sabi ng
Wala pa
nurse, hindi pa available. So, pero dizzy pa rin ako, doc. Are you going to observe again? Observe pa rin. Pero di ba, ang ating bradycardia, for the treatment of your bradycardia with symptoms. What's the proper treatment? Are you going to treat or not?
Atropine.
Di ba? Observe. Basta, pag bradycardia, if you have a bradycardic patient, asymptomatic, stable, observe. But if you are symptomatic, unstable, then treat.
We give atropine po, doc. Starting dose is 0.5 milligrams with a maximum of 6 doses.
Baka yung dizziness niya is due to bradycardia. Okay? But you have to be, you have to watch out for any chest pain kasi atropine will cause tachycardia if the patient has a history of MI. Pwedeng magkaroon siya ng MI. Okay? So you should watch out for those. Okay? And then, so nag-treat ka na, doktor. No? So tapos dumating na. Upon hooking to ECG, it reveals this one. Dumating na yung ECG monitor mo. Mayroon na after 1,000 years. Dumating na rin yung ECG monitor. But upon hooking, your ECG rhythm is this one.
AV block po, second degree AV block.
Second degree AV block, type. Type 1, type 2.
Type 2 po, doc. Because
Why? Okay. You have no prolongation of your PR interval. Same pa rin yung agwat ng PR interval mo. So, pero nagkaroon ka ng walang QRS. So that's second degree AV block type 2. Mobitz 2. Okay? Intindihan? So since your BP is now 60/40, heart rate of 45, RR of 20, of pusat of 95% kasi naka-nasal cannula ka na. So still conscious yung pasyente. So what's your management strategy for second degree AV block type 2?
Since patient heart rate is bradycardic, doc, and unstable, we give atropine at 0.5 milligrams IV. And if the heart rate is still below 50, we continue to give 0.5 milligrams IV in 3 to 5 minutes interval. At maximum of
3 doses?
Maximum of 3 milligrams.
3 ba?
6 doses.
3 ba?
6 doses po. 3 milligrams po yung equivalent. 6 na 0.5.
Nililito mo ako. Nagtutuloy ako.
Maximum of 6 doses po.
Okay?
Kon lang po. Minultiply ko lang po yung 6 0.5. Kaya 3 milligrams.
Okay. Pero after after maximum dose ng atropine, can you still give your atropine?
Di na po, Doc. We move on. If if atropine is unsuccessful, we begin transcutaneous pacing po, Doc.
Okay. Better to do transcutaneous pacing na. Pag hindi talaga ma-manage ng atropine. Pero if your transcutaneous pacer is not available, you can opt to start your infusion, such as dopamine infusion.
Dopamine po, Doc.
Until mayroon ka ng pacer na dadating or pupunta na yung pasyente sa hospital na with pacers. Okay?
Copy po.
Okay, after 10 minutes, so while you are talking with the patient, after 10 minutes, the ECG of your patient reveals this one with BP of 110/80, heart rate of 140, RR20, O2 sat 99%. So what's your diagnosis for this rhythm?
Doc, sinus tachycardia po.
Sinus tachycardia?
Yes, Doc. Because
Are you sure?
below 150 yung heart rate po. Kapag SVT po kasi I have read it is more than 150 beats per minute.
Do you have your P wave?
Kung yung tracings po yung pagbabasihan, Doc, I'll consider SVT kasi fuse po yung T wave and P wave. But since I base my diagnosis sa heart rate na nakabigay.
O yung 150 sabi lang niya sa book. Pero pag nakita mo yan sa tracing na ng ECG, you consider SVT na siya. Okay? Kasi kahit na sinasabi dun sa monitor mo na heart rate of 140, maybe the 140 is not correct. You should rely on your ECG tracing while you are palpating the patient, if the patient has pulse or not. Kasi hindi mo naman na mabibilang talaga, bilangin mo nga yan, yung heart rate. Hindi mo mabibilang pag ganyan na yung pump ng iyong heart. So that's SVT. Tama?
Apo, Doc.
Okay. So, SVT, stable or unstable? Hello?
Hello, Doc.
Again,
Stable po, Doctor. Stable kasi normal yung blood pressure.
Okay. Your BP is 110/80, di ba? So, the patient is still stable. Okay? SVT is stable. Okay? So, what's your best management strategy for SVT stable? Stable SVT. Can you do your non-pharmacological,
vagal maneuvers po.
vagal massage? Is that correct? What's the age of your patient again?
50.
50. Ano yung sinabi ko nung last lecture? If the patient's age is more than 45 years old, bigger ang risk for any thrombosis. So, it's not advisable to do carotid massage or vagal maneuver like carotid massage. Kasi, risk for emboli. Okay, baka magkaroon ka ng embolism. So, how are you going to do your vagal maneuver?
If possible po na gagawin yung vagal maneuvers, we massage yung bandang carotid.
Hindi nga pwede kasi 50 years old yung patient.
Pharmacological na po, Doc. We give the adenosine 6 mg rapid antidote.
Mayroon pa tayong isang maneuver para ma-stimulate mo yung vagus. Mag-cause ka ng vagal.
Cough po. We ask the patient to cough or strain.
Tama. You can ask the patient to cough or strain if the patient's age is more than 45 years old. Pero wag na wag mong imamassage na ganyan ng ganyan. Okay? Pero after 5 seconds or 10 seconds or after doing strain or coughing at hindi pa rin nawala yung SVT mo. So, what's your next?
Pharmacologic na po. We give the adenosine 6 ml.
So, what's your again? Anong ibibigay for pharmacologic treatment?
Adenosine po. 6 milligrams IV po.
So, how are you going to give your adenosine again?
Give it IV rapid push, then flush with saline po. NSS.
2060. Okay.
Initial dose and second dose is 12 milligrams po. Hindi pa rin correct.
Okay. So, after 2 minutes, ECG reveals ito na yung ECG, but no pulse.
Pulseless electrical activity. No?
So, what's your management?
We do CPR, activate emergency response. We shout.
First, your emergency response, ask for help. And then, do your CPR. Okay, what again the characteristics of your high quality CPR? Give 3.
We push hard at least 5 to 6 centimeters deep and give push pass for at least 100 to 200 compressions.
100 to 120
per minute.
Hindi 200. Namatay ka na.
120.
Okay. Okay, another one.
And the ratio will be for adult 30.
Basta HLSDL test natin is for adult. Okay, yung pedia, halos magkaparehas pero may pagkakaiba sa ratio ng ventilation compression. Okay? And then, so may tatlo ka ng high quality CPR characteristics. So how are you going to manage again? By doing your CPR. So after 2 minutes of doing your CPR, what's your next step?
Since the rhythm is non-shockable, we continue CPR for 2 minutes and give epinephrine 1 milligram every 3 to 5 minutes po. And do endotracheal intubation.
Agad-agad?
We hope to CMPO.
Remember, mag-isa mo pa lang dito ka, wala ka pang kasama.
Okay. Diba? Sa ER na tayo.
To do it. Diba?
Continue the CPR pa.
CPR. Stop ka muna. Ventilate. 30 is to 30. And then, dalawang ventilation. And then, after that, CPR again. And then, ventilate. And then, after 2 minutes of doing it, you can now give your epinephrine. If mayroon ka ng kasama, you can ask your teammate to intubate the patient while you are doing your CPR. But then, you should remember, circulation is the priority. Hindi na yung airway. Circulation. Ang unang-unang. Hindi airway. Ha? Hindi mo priority ang airway. So, pag na-revive mo na yung pasyente, then you can intubate the patient now. Basta na-ventilate mo ng na gagawa mo yung 13:2, okay lang yun. Okay? Naintindihan?
Yes.
So, after 2 minutes, pag nabigay mo na yung epinephrine, so, are you going to stop again?
Reassess po, Doctor.
Okay, reassess. Okay. Hindi naman pwedeng tuloy-tuloy yan. Okay? You should observe your SAS after 2 minutes. And then after that, if the patient's rhythm is shockable or non-shockable, then address it. Okay? If it's non-shockable, then CPR. Then, kung kailangan ulit ng epinephrine, give epinephrine. Okay? Okay, for the question number 5, after 2 minutes, ECG reveals this one, this rhythm. Is it normal or not? Is it normal sinus rhythm? Sino yung iba pang kating mo?
Hindi ko natitingnan yung heart rate, Doc. Para sa akin, normal. Sinus rate.
Okay. So, normal. So, how are you going to confirm if it's normal talaga?
You check the pulse.
Okay. So, always, pag makita mo yung monitor, ay, mayroon ng tracing, normal sinus rhythm na. So, sasabihin mo na, na-revive ko na, okay. You have to remember, you should confirm, always confirm. Titignan mo yung curve niya, kung may pulses ba talaga. Okay? So, you have now your pulse. It's 59. Diba? O2 of 99%, RR0, BP 80/60. The patient now is GCS 3/15. So, again, what's your diagnosis for this rhythm?
Normal.
Normal sinus rhythm. Okay, the patient has revived. Okay, so while you are doing all your CPR and reviving the patient, what are the possible reversible causes of arrest for this patient?
Hypoxia po.
Okay.
Hypothermia.
Bakit hypothermia?
Nag-arrest po ka siya.
Baka naman pinalamigan mo kaagad yung room mo.
Aircon po sa... Can I consider hyperkalemia, though? But we still need labs.
Pwede. Okay. Sige. And then, so, for number 7, what are you going to do once patient had returned to spontaneous circulation? Nasa ROS ka na, di ba? Wagi ka na. Na-revive mo yung pasyente. So, what's your next step?
Check na natin.
Ha? Check the BP. Your BP is now... Ha?
I-check the BP po.
Your BP is 80/60.
We fluid challenge po.
Fluid challenge. How are you going to do your fluid challenge? Is yan ba yung correct na verb, fluid challenge? Or are you going to hydrate the patient? Give volume. Okay. So, bigyan mo na volume. Kasi hypotensive yung patient, di ba? The patient is unstable. Is it okay na magbigay ng plain LR? Or straight ka na sa pressor? Ha?
Saline po. Plain LR na.
Okay. Okay, ito na naman. You have to remember, class, sa lahat ng hypotension, in almost all of hypotension, start giving first your volume before starting your pressor, except for cardiac tamponade, for patients who have crackles, patients who have renal problem. Those are the exceptions. Okay? Basta lahat. You cannot start pressor if you have no volume. Imaginin mo, yung heart walang laman and then you give pressure. So, nagpa-pump lang yung heart pero wala siyang cardiac output. So, you should put some volume on that heart para pag nag-pump siya, meron siyang cardiac output na ipapump out. Okay? Naintindihan? Except lang talaga sa mga mayroong renal problem, crackles, cardiac tamponade, or anything na nalulunod yung pasyente. You cannot give further volume for those kind of patients. Okay? So what else?
After we correct the BP, doc, we obtain a 12-lead ECG.
Okay, what else? RR mo 0, doktor.
Naka-intubate na po siya natanap.
Hindi mo pa in-intubate kanina, di ba sabi ko sa'yo, ang priority mo is circulation.
CPR, apo. Intubate pa natin, doc.
Di ba?
And do a capnography.
Okay, for the primary confirmation again?
Capnography.
Hindi, mali ako yung kanina.
Ay,
Na
5 points.
for the primary, 5 points of auscultation. Kasi you have to remember lahat. You have to auscultate, you have to palpate your patient. Okay, don't rely on the monitors. So the primary confirmation of your airway is your 5 points of auscultation. So how are you going to do your intubation? I will just show you some of the equipments that we use during intubation. This is what you call your laryngoscope. We have parts of this. You have your blade. We have Macintosh, and then for the Macintosh, the C blade, Macintosh, may C yun, Macintosh. And then we have another blade which is the Miller L. So, una, Miller. Okay, Miller blade. We have sizes for this one. 1, 2, 3, 4. Okay, and then this is the handle of your laryngoscope. So when you're going to put it, you assemble it, you just put it there, and then you have to check for the light of your laryngoscope. It should have a light before doing your intubation. Kasi pag patay naman yung ilaw mo, paano ka makaka-intubate? Okay, you should check always before intubation. So, ganito lang, just push and then ganun lang. Okay? And then you're going to grip this using your left hand. Kasi ito ay left-handed laryngoscope. So, ganito dapat. Okay, ganyan ang paghawak. Hindi ganyan ha, baka kayo yung nasa pelikula na nabaliktad. Okay, so your blade should conform to your airway. Pag ganyan, di ba, yung arch ng ating mouth, pag ganyan. So, ganyan din. Okay? Okay, and then, this is your tube, your ET tube. We have sizes on also. So, this is size 7. We have the cuff, ito, yung cuff, and then eyepiece, and then this one. Yeah. Ito yung guide wire. We use this to make the tube stable during intubation. Okay? Okay, when you're going to intubate, I will just show you how to intubate. So ito yung mouth ng pasyente, ito yung ulo. Ganyan. Dito yung ulo niya, and then this is mouth. This is the eyes. Yung nandito, eyes yan. Tapos nandito, mouth. Imagine ninyo ha. Okay, so for example, this is the mouth. You're going to insert your blade on the right side of the mouth of your patient, and then swipe your tongue, and then put the tip of your blade at the vallecula. So saan ang vallecula ngayon? So the vallecula is where this is your tongue. Ito yung tongue. Okay? And then this is your epiglottis, and then glottis, and then esophagus. Can you imagine it? So class, this is the tongue, epiglottis, ito, glottis, esophagus. Okay, mas malalim ay mas posterior yung esophagus ha. Imagine niyo. Mas anterior ang iyong glottic area where your trachea starts. Okay? So this is the vallecula in between your tongue and then your epiglottis. This is the vallecula. Can you see it? Naiintindihan ba, class? Gising pa ba kayo?
Yes po.
Okay, so you're going to put the tip of your blade on the vallecula, and then once you have applied on the vallecula, then you should lift it. Lift, you just lift and then slightly forward. Lift, forward. Okay, huwag ganon ha, hindi ganon. Pag ganito yung ginawa ninyo, mabubungian yung pasyente. You just lift it. Ganyan. Okay? And then once you have seen your glottic opening, then you should insert that's the time you're going to insert your ET tube. So how are you going to insert your ET tube? You just insert it on the right side of the mouth of your patient. So kunwari, nandito yung laryngoscope mo. Nandito. Put it here. Insert it here. Okay? Then you have to see to it that the tip of your ET tube is going inside your glottic opening. And then, kunwari, ito yung glottic opening mo. So, you should push further your ET tube until sa dito. Or, pag wala kayong graduation, you should just push 2 cms more after makalagpas siya sa cup. Okay? So, kunwari na nandito insert mo. So, 2 cms more. Then stop. And then you just pull the this guide wire, and then inflate it. Inflate the cuff and then secure. Before securing it, once you inflated it, you do your 5 points of auscultation. If equal breath sound, and you have checked that the breath sound is positive on your base and apex, then you can secure your ET. Okay, naintindihan? So the sizes for adults, if for Filipinos, it should be 6.5 to 7.5. For females. For males, it should be 7 to 8 to 8.5 for females. So what's the level of your tube? For females, 19 to 21. So how are you going to know the landmark for the depth of your tube? At the incisor, upper incisor, if the patient has teeth. If wala naman, yung wala siyang ngipin, you should use the angle of the lip as your landmark. So, hanggang dito lang. Kunwari, ito yung lip, hanggang 19. 19 to 20 pag babae. Pag lalaki, 20 to 21. Okay, hanggang ganyan lang yung depth ng inyong ET. Okay, once you have intubated the patient. Wag mong hanggang dito. Okay? baka pumunta ka na endobronchial. So, wala ding, hindi rin maganda ang ventilation mo. Pag one lang ventilation ka lang, you should be at the karay na lang, above karay na lang dapat. Okay, so how are you going to assess it? So, yeah, 19 to 20 pag babae, pag lalaki, 20 to 20. Okay, so after intubating, after inflating the tube, and then securing it, and then checking for the breath sound and chest rise, then you can opt to put oral airways for you to protect your ET tube, especially for patients who are conscious. Okay, so how are you going to put this one? So this is the mouth again. Ulo ito, mata ito ha, mata. Dito ang chin. Okay, so you're going to insert like this, and then while you are inserting it, you're twisting it to conform to your mouth shape. Okay, so ganyan. In-insert mo, while you are inserting it further, you're twisting it para mag-conform siya sa shape ng iyong oral airway. Okay? Naintindihan? Class?
Yes po.
Okay, so, and then next, for the D. So, is the patient conscious or not?
Patient is comatose. Unconscious.
So,
We
what's
do
your
the
next step?
therapeutic temperature management.
Okay,
The
so
patient
how are
in
you going
normal
to?
keep the patient in normal temperature.
Normal temperature pa rin ba yung 32 degrees Celsius?
32 degrees po, Doc. Mababa na po. We
Oo.
give warm
So,
blanket.
normal temperature. That's what you call targeted temperature management, diba? That's why your range for your temperature is 32 to 36 degrees Celsius. Okay? Hindi, kasi pag comatose, for you to preserve the brain's function, you will do targeted temperature management. Naintindihan? So, paano mo gagawin ulit? To
Pag
maintain your
hypothermia.
temperature
Pag
at
hypothermia. Hello
to
po.
make your patient at 32.
We give warm blankets po.
Hindi nga siya normothermic masyado, di ba? Lalo pag ang aim mo is 32 to 36. Pag 36, pwede. Pero pag 32, so hypothermia na yan ng konti.
Or no.
Okay? Pero your aim for your patient, lalo pag comatose, is 32 to 36, di ba? Ang iyong targeted temperature for comatose patient lang, di ba?
Yes.
So, okay, i-warm mo. Baka pumunta pa siya ng 37.
So, wala na pong gagawin.
So,
Kasi normal.
what ka gagawin? Kung gusto ko 32, ang targeted temperature mo. So, what's the strategies that you're going to do?
We put ice packs na lang po dun sa singit-singit. Sa axilla.
Pwede. What else?
Or
Pwede mong palamigin, di ba? Yung IV fluid mo.
IV fluid po.
You're not at risk of any tamponad naman, di ba? Tama?
Opo.
Pwede mo. Okay, so after doing your targeted temperature, so for your post-arrest care,
Hindi na ba kakuha na ng brain CT?
brain CT scan, pwede. Pwede. Lalo, your patient is having dizziness. Diba? Baka meron na siyang stroke. Pwede. What else?
We evaluate and treat the reversible etiologist, and we refer to expert consult to a specialist.
Okay. Before referring your patient or transferring your patient to an intensivist, what else are you going to insert or ano pa?
Okay, insert NGT, IFC.
What else?
And get a portable chest X-ray.
Then do the 12 lead ECG.
12
Kasi
lead ECG.
what you have done during the CPR or resuscitation, you only had 3 leads ECG, di ba? Okay. Di ba? 3 leads lang. Yung napansin ninyo, 3 leads lang. Black, white, black, red. Di 3 leads lang. But before transferring your patient, you should do 12 lead ECG. Magkaiba yun ha. 12 talaga na. Ay, na leads. Okay, meron dito, meron dito, meron. Nakakita na kayo nun. Ay. Okay, that's the difference. So, after doing all those procedures, you can now transfer and endorse your patient to what? ICU. Okay. If you're, what if you're entertaining MI? Where are you going to refer your patient?
Cardiologist.
Okay, cardiologist. Cut lang. Okay? Kasi MI, tama. Doktor, hindi ko na nakita yung si doktor. Usually, 90 minutes. The golden period for MI, kung gusto mong ma-reverse yung infarction or ischemia, ginagawa nila 90 minutes. Dapat 90 minutes from the time na nagkaroon ng symptoms yung pasyente up to the procedure, dapat magawa na nila. Okay? 19 that's the golden period for any infarction or any ischemia. Okay? And remember also that you should do all the necessary procedures for any laboratories or any insertion of IFC or NGT before endorsing your patient to other doctors. Kasi sino ba naman ang gustong tumanggap ng pasyente na wala man lang nakakabit na IFC, NGT? Baka kakalbuhin ka ng intensivist pag walang mga naka-hook na anything sa pasyente. Okay? Be courteous and be responsive before endorsing your patient to other doctors. You should remember that. Okay? You should remember the golden motto na do unto others what you want others to do. Okay? Kung gusto mo ma-endorsean ng pangit na pasyente or hindi ready na pasyente, mo gawin yun. Pero kung gusto mo maganda lahat ng i-endorse sa'yo, you should do your duty. Okay? Naintindihan? So, okay, very good. Group 5. So again, you should write kung sino ang nandyan na kaklase ninyo na nag-participate, naka-group ninyo. Okay? Huwag na niyo isulat yung absent. May mga questions pa ba kayo? Anong oras na ba?
Doc, it's 9:53 po.
9:53 na? Isa pang, is it okay? Isa na lang. Hindi na natin matatapos to class. Ano na to? We should have another, ano yun? Teka lang ha. Ano yung
Hanap po ako ng other schedule po, Doc.
Yes. But, mas maganda sana before exam ninyo. Ano yung question? May concern lang po ako, members of the class, but
Kanina po yan, Doc.
okay.
Doc, our exam is next week Monday po.
Oo. Kailan
But,
ang Sunday?
um,
Mayroon?
may nakaschedule din na classes po sa Sunday.
Oh, kailan kaya? Busy ako ng Saturday. Bukas busy din ako. It's okay, long exam lang naman, so mag-review na lang kayo. Pero sana mas maganda sana na matapos natin tong SGD para mas ma-answeran ninyo yung mga tanong ko sa long exam. Pero it's okay. Basta importante, matapos tong SGD before your final exam.
Noted po, Doc.
So,
Hanap po ako ng open time.
Oo. Maghanap ka ng slot next week. Pero on Monday, we will have your long exam. Tama na to, no? For the remaining 6 group, we should do it na lang next SGD. Okay lang sa inyo? Sige, inaantok na ako. Alam kong inaantok na rin kayo. And then, siguro, kailan ba ang pwede? Wednesday?
Doc, i-check ko po ulit yung schedule and i-offer ko po yung mga free times na makikita ko po.
Oo, yung mas mahaba sana kasi for sure baka makat na naman. And then yung mga remaining groups, answeran ninyo ng mabilis para mabilis din ang ating discussion. Okay? And then for your long exam, 50 points lang yung ibibigay ko. Naintindihan?
Yes po, Doc.
Over 50 points lang. Pero nandun lahat yung local anesthesia, ACLS, BLS, and pain management. Okay? And looks like ganito yung exam ninyo. So you should know what's your management and strategies, and also you should know the proper treatment for each case. And ano pa ba? May mga questions pa ba kayo? How many minutes po sa exam? The usual, up to, since 50 points lang, so 1 hour lang. Kasi pag 100 points, 2 hours, di ba? So we should start at, inform ko na lang si Dr. Elijah kung 1 p.m. tayo mag-start or 2 p.m. Basta 1 hour lang yung long exam ninyo.
Okay po.
Okay? Kasi 50 points lang yun. Mabilis lang. And then, ano pa ba? Wala nang questions? May questions ba kayo sa intubation? Ay, ito pala for you to para ma-orient lang kayo. Pero I know, lahat kayo nakakita ng ambu bag, di ba? So, damay ninyo si Dr. Ramon. Nasis ako nung dalaga ako. Now, I'm already married. Ramos. Okay, ito yung, ay, hindi ko Okay. So, this is your ambu bag. Ito yung adult ambu bag. And then, this one is your face mask. So, how are you going to apply your face mask? So, this is the nasal area and then this is your chin area. Kung saan yung ganito. Siyempre, always, tingnan ninyo kung ano yung ka-shape or kung ano yung nagko-conform para hindi kayo pagsabak ninyo sa clerkship, hindi kayo yung pagtatawanan na ay hindi niya alam. Ganon. So, you should know. Kung hindi mo alam, ask. Kung hindi mo pa rin alam, gamitin mo yung common sense. Ito, ka-shape niya. Siguro ito naman. Ka-shape ng ilong. So, this are where you're going to put this here. Makikita nyo ba ako?
Yes po, Dok.
Okay. So, ganito. Ganyan. Ganyan ang itsura niya. Okay? So, kunwari, may pasyente ka. Ganyan. Okay? So, how are you going to hold your face mask? Remember the C and E. C and E. So, for the C, you hold it like that. And then the E, you hold the jaw of your patient. Pero iwasan mo yung carotid area kasi you may cause vagal stimulation. So, dito lang sa bony parts ng jaw. Okay? So, E. And then, parang ganyan. Yan. And then, E. Naintindihan? Ay, medyo mataas. Sorry naman, medyo mataas na ako. Yan. Naintindihan niyo? E. Ay, E, C. Ganyan. So, pag hindi mo na-ventilate or wala kang chest rise, you should lift the head of your patient for you to ventilate it properly. Okay? So, how are you going to do it? So, kunwari, ganyan. So, 30 compression and then 1,001, 1,002, 1,003, 1,004, 1,005, 2. And then CPR again. Okay? Naintindihan? Pero dapat nakahook ka din sa oxygen, ha? Baka hindi mo hinook sa oxygen, ito na lang, room air lang ang ginawa mo. So, hindi mo rin nabigyan ng ventilation yung pasyente na maganda. Hindi rin umaakyat yung photostat mo. Okay? Yun lang. Ano pa ba? Wala naman na. Yun lang, importante. Na-show ko na sa inyo tong laryngoscope and the blades and the ET tube and this one oral airway. And I hope sa next 6 group, siguro handang-handa na kayo, diba? Okay, any questions? Class? Ready na ba kayong gumawa ng CPR, mag-resuscitate ng pasyente? So I hope every time you have you see a patient lying sa side ng streets or even dun sa kapitbahay ninyo, kunwari may nag-aas ng help, I hope pupunta kayo and try to help. Hindi yung i-deny ninyong doktor kayo. Okay? Okay? Sige, good night na. Wala nang questions, ha? O 109 na tayo ngayon. Basta, kung sino man ang group leader, kung hindi nakaparticipate during SGD, yung ka-group ninyo, wag na ninyong isusulat. So, it's up to you if you're going to write the names of the people na hindi naman nakaparticipate. Ano yan?
Dok, i-collect ko po yung names ng hindi po nag-participate.
Yes, please. You collect na lang yung each group na nag-participate. Okay? For group 3, 10, 5, 8, yung mga nag-participate lang. Okay? Kung
Okay,
wala
po.
sila, wag ninyong isusulat. Kasi 0 sila. This would be 50 points all in all for the combined SGD and your written answers for these cases. Okay? That's why your long exam is 50 points. So ito, yung another 50 points. So it's very malaki, di ba? Kung 0 sila, sorry. Okay? Okay, good night and good luck sa exams ninyo. Bye!